Hello students, myself Dr. Maddineni Srinivas, your dermatology faculty in Cerebellum Academy. In this video, we are going to see the previous year questions of NEETPG 2021 asked from dermatology subject. So this is our first question. A 10-year-old male child comes with the complaints of mild painful swelling over the scalp for a period of 3 months. And he also has a pet dog at his home. What is the diagnosis of this given condition? So please remember, when you get this kind of a picture where you are able to see that there is a boggy swelling, of hair loss, boggy swelling associated hair loss over the scalp, and if you see inside this swelling there are multiple pustules present. And it is also mentioned in the question that there is a history of a pet dog. So with all these clues, if you have marked the answer as option C, Kion, you are absolutely correct. And why is this pet dog history important? Because this is going to tell us that there are zoophilic fungi which are associated with this Kion. Because they are zoophilic, they are associated with excessive inflammatory response, because of which the type of alopecia which is seen in Kirion is a scarring type of alopecia, See, all these are very, very important points, and this topic tinea carpatis is extremely important. And the other points which might be mentioned in the question can be there can be a mention of crusting and matting of the hair or the scalp, and there can be a mention of a pluckability which is called as easy pluckability of the hair, which can also be mentioned. So this is the point, which is zoophilic organisms, which the examiner is trying to convey by giving the pet dog as a clue. This is the next question. A child with a history of night blindness presented with the following findings, and you are able to see that over the elbow there is a picture depicting hyperkeratotic papules, which are follicle oriented. So if you get to see this kind of a picture in a child with a history of night blindness, always think about vitamin A deficiency. And yes, the manifestation which is shown here is phrenoderma. Phrenoderma simply means toad skin, in which the skin is going to appear very rough, just like the skin of a toad. Okay, these are the important points related to phrenoderma. This is the next question. What is the most probable diagnosis for a 35-year-old patient who has presented with easily rupturing flaccid bullae on the skin and whose biopsy indicates a suprabasal split? So this is a straightforward question in which all the clues are given. There is no need of any other clues apart from this. So if you have thought about the diagnosis as pemphigus vulgaris, you are absolutely correct. So what are the points for pemphigus vulgaris? The presence of flaccid bullae and the presence of suprabasal split. These are the points for the pemphigus vulgaris. See, pemphigus vegetans, it is a rare variant of pemphigus vulgaris, in which we are going to see vegetative lesions. Whereas pemphigus foliaceus, in this, remember, it is due to the antibodies against desmoglein 1. So in this condition, please remember, we are going to clinically see mainly scaling, cornflake like scaling will be predominantly seen, but the presence of bulla is very difficult clinically, and also the split is going to be subcorneal split. Subcorneal split, but not suprabasal split. Okay, the next one, which is the erythema multiforme, please remember in this we are going to see target lesions but not the flaccid bullae. So that is the reason my answer is going to be option B here. So in this image you can see this is the picture depicting pemphigus vulgaris, where you are able to see this flaccid bulla which is present, and you are also able to see that there are some erosions present over the body and a few areas of skin which is showing complete peeling off of the skin, which is pointing towards Nichols kissing positivity. Whereas here this image is showing some vegetative lesions which is suggestive of pemphigus vegetans. So here are the vegetative lesions. So this is the next MCQ. What is the recommended treatment for a patient who has paronychia on their index finger and is showing a reddish streak on the forearm as depicted in the image? So paronychia is the infection which is present periungual infection of the nail folds due to staph aureus is called as paronychia, and this paronychia can have a complication which is referred to as lymphangitis, in which we can see this kind of reddish streaks present as you are seeing here. So in such cases, because the causative agent is staph aureus, so the medication which is going to target the gram positive organisms has to be used, and so the answer is going to be amoxicilla, which has which for which the gram positive organisms are going to be susceptible. Okay, this is the next question. In a case where a patient is undergoing MDT, that is multi-drug therapy for Hansen's disease, there is a sudden deterioration of the existing lesions and there is a history of nerve complications. What course of action would you consider taking next? So this is the MCQ. So taking into consideration that it is a leprosy patient and now there is a deterioration of the existing lesions and there is some nerve complication, so all these are pointing towards a diagnosis of leprosy with lepra reaction type 1 lepra reaction. So please remember, in the case of the lepra reactions, the treatment is going to continue the multi-drug therapy and add systemic steroids. So the answer is going to be option number D. So continue MDT and start systemic steroids. Please remember, even if it was type 2 lepra reaction which the examiner gave, the answer is going to be the same. The answer is going to be the same because see, basically in type 1 or type 2 lepra reactions, the treatment is going to be with systemic steroids with continuation of the multi-drug therapy. Okay, this is the next MCQ. See, this is a second question regarding the fungal infections of the scalp, tinea capitis. So it is a very important topic. A 30-year-old male patient visits you with inflammatory alopecia. So again the question is on inflammatory alopecia. This type of hair loss is commonly associated with which variant of tinea capitis infection? Please remember, the tinea capitis is broadly divided into inflammatory, non-inflammatory. So in the inflammatory varieties, we have Favus and Kirion, which is the answer here. Very important. This inflammatory variety is also called as scarring type of alopecia. Why? Because the hair fall which is seen in these children is going to be permanent. The hair is not going to come back. And the other type of tinea capitis which you should know is non-inflammatory variety. Non-inflammatory variety, in which we have the examples of gray patch and black dot. gray patch and black dot. Okay, these are the important types of tinea capitis which all of you must be aware of. Very, very important. And you can remember that the gray patch variety is also called as ectothrix type, and the black dot variety is called as endothrix type. So as you can see in the other options, ectothrix, endothrix are mentioned, which you can remember with this gray patch being ectothrix and the black dot being endothrix. Okay. So these were the questions asked in the NEETPG 2021 from dermatology. So I hope this video was helpful. So if you have any more queries, you can reach out and ask the Telegram group, or in the app itself, you can report the question. Okay. Thank you so much. Happy learning. Bye bye.